Hello, everyone. Welcome back to our live session today, our live Thyroid Thursdays. So, welcome over here today. I'm Dr. Anshul Gupta, your host for today's session. I hope you all know about me, but I'm a former Cleveland Clinic functional medicine physician from US, and I help people, with chronic health conditions like thyroid, autoimmune diseases, inflammation. And today we are talking about hidden vitamin and mineral deficiencies, which are responsible for causing inflammation. You might all know about basic vitamins or vitamin D and other things, but today's discussion is about all the other vitamins and minerals which are actually hidden deficiencies, which most people are unaware of because your regular blood work do not check for them. And how to increase them naturally, what is the mistakes a lot of people are doing while taking these vitamins, so that you can get your health back. So that's about the discussion today that we are going to happen. This topic was going to be discussed a couple of weeks back, but unfortunately because of technical issues, the presentation was just stuck and it could not move forward. And I promise you all that we are going to come back with this presentation. So that's the reason we are back today. And I hope, God forbid nothing happens and we are smoothly able to get through this discussion. So yeah, as always, it's been a while. I'm really happy to see you back again. It's always nice. I'm looking forward to this connection because this is the way that I can connect with all of you all over the world. So please introduce yourself. Where you are from, what are your issues you're dealing with, any questions you have, because we are going to do the presentation, and obviously after that I take your questions. And as always, try to post your questions so that I'm aware of those and try to take as many of them as possible. But yes, introduce yourself, tell me who you are, where you are from, if any particular problems you're dealing with, so that way I know you, and I can welcome you over here, and then I can answer questions later on. But let's get started. So, Ankita is joining us from India. Welcome over here. Kalyani is joining us from US. Welcome. And who else is there? Deepali is joining us from Aurangabad. Welcome over here. Priyanka is joining us from Delhi. It's so nice to see you as always. Um, Somebody is already posting the questions about my platelet count is always low, and also hemoglobin being low. So very important. You should listen to today's presentation so that you will know why your hemoglobin is low and how to increase it. And why is it so important? Because it can actually be one of those reasons of causing inflammation in your body. So absolutely. And these are all the things that we want to know about, right? Because people sometimes are not able to put all of these things together. There is a lot of interconnectedness which is going on in our body. Okay, and then we are all focused on just one particular part of our body. Let's say, like, we're talking about thyroid. Everybody is just hyper focused on taking care of the thyroid gland. Well, thyroid disorders are a systemic disease. That means all the systems of your body are involved in this disease, not just one. Okay, so that's the reason there is interconnectedness in our body, and you guys should be aware of those. And then only you will know what is needed to be getting better. So I'm glad that you brought up this question. We'll definitely answer that later on. Rajesh is joining us from India, Gujarat. Welcome over here. Um, Somebody joining us from Pennsylvania, and then somebody else is joining us from UK. I don't know the name. That's great. Chandramoli is joining us, and she has Hashimoto's disease, so very common disorder. So yes, Hashimoto's disease means you have inflammation in your body, and that is again very important to know all the deficiencies that your body is going through, so that you are aware of them. So that's great. So that is so nice to see you. Somebody joining us from South California. Wonderful. Welcome over here. And then from Bangalore. So, yes, that is so good to see people from all over the world joining us over here in these live sessions. We will just wait for a few seconds before we will start the session formally, so that it can talk to you about all the hidden deficiencies. And then, as and when your questions pop up in your head, please again post them into the chat section, so that I can keep looking at those questions. And in case there is any pertinent question that comes up based on what I'm presenting today, so I can answer those for you. And then, obviously, in the end, I'm going to open up for more questions also. But if you have question that comes to your mind, post it in the chat section so we can take care of them. So yes, somebody joining us from Hyderabad, then Mauritius, then from Ireland. So that's great. So wonderful. Good to know, guys. I think I'm going to start with my presentation, and then we are going to so that you guys have an idea of what I'm going to do. Um, okay, here we go. That's great. Alrighty. So that's the topic today is hidden vitamin deficiencies and mineral deficiencies which are fueling inflammation, right? And how to fix them naturally. And first of all, let's have this discussion about why, right? Why it is important. So, as you know, like chronic inflammation, as I always talk about, is a root of all the problems. Like whatever disease, long term disease you have, basically it is because of inflammation. It causes you feeling tired, fatigued, weight gain, thyroid problem, autoimmune diseases, premature aging. It is a cause of Hashimoto's disease, thyroid problems, autoimmune conditions, cancer, heart disease, diabetes. Everything is because of this inflammation. Now, in functional medicine, we keep going deeper and deeper to find answers. So, the first answer is that if you have a chronic health condition, the underlying issue is inflammation. Now, the next question we want to go deeper is that why? What causes this inflammation? And deficiencies of vitamins and minerals, okay, is a major reason which also causes inflammation, okay. And that's what people know about vitamin D, vitamin B12. Those are the major vitamins they know about, but they don't know about all the others, okay. So that's the reason we want to kind of talk about all of them. Now, how does deficiencies actually causes inflammation, right? So basically, whenever your body is deficient into certain vitamins and minerals, that increases oxidative stress. Now, what is oxidative stress? Oxidative stress is basically accumulation of chemicals in your body which increases inflammation, okay. This oxidative stress, this basically chemicals which accumulate in your body lead to production of new chemicals which are called cytokines, and that ultimately causes chronic inflammation. And this chronic inflammation ultimately basically damages your body and leads to various diseases, right? So that's the way these deficiencies, by affecting your antioxidant system, by your immune system and your cellular functioning, leads to inflammation in your body. So the first vitamin which everybody knows about, and if you don't know about it, you should know about it today, right, is vitamin D, right? Over more than 200 genes, okay, are controlled by vitamin D. Literally, vitamin D is now these days called as a hormone because it has so much widespread control of different parts of your body that a single vitamin cannot do everything. So we think that vitamin D actually is a pro hormone. That means it has control over so many different things. So basically, vitamin D deficiency causes increase IL-6 and TNF alpha, which are two inflammatory molecules in your body. And low vitamin D literally has been associated with all the diseases, whether it's autoimmune diseases, thyroid problems, whether you say cancer, whether you say heart disease, whether you say bone disease, hormonal dysfunctions, all of those things have been associated with vitamin D. So I cannot stress the importance, of vitamin D, in our body. Now, here's the problem. Why are more and more people becoming deficient in vitamin D? So, very first reason is that we have lack of sun exposure because we are living indoors all the time, okay? Or we are using, like we are clothed from head to toe. right? So that clothing, doesn't let the sun to be on our skin. That's where the vitamin D is being produced. The second, which is also important, is that there is poor absorption of vitamin D as well as poor conversion of vitamin D in our body. Now our body actually makes, so there are different forms of vitamin D, right? So vitamin D2 and vitamin D3. So vitamin D2 needs to be converted to D3 for our body to utilize it. And that conversion doesn't happen in the body properly because, our bodies is deficient in other cofactors which are needed for the vitamin D to function better, like vitamin K2. Like it also needs good amount of fats in the body for that conversion to happens. It also needs, your liver and kidneys to be in healthy shape for that conversion to happen. So that's the reason we are unable to convert the vitamin D into the proper form of D3, and that's the reason we are also deficient. Okay, our guts are not functioning. That's where again, that conversion doesn't happen, right? So that's the reason vitamin D is literally low in everybody, across the world. Yes, even in countries, which are very hot, tropical countries, right? And even when they check their vitamin D levels, it is low because of all of these reasons, okay, which I shared with you. Okay. Now the problem is that there are not many good food sources of vitamin D, right? That's the also the bigger problem. Now certain fortified milk, okay, or egg yolks and fatty fishes, again depending on how much they have been exposed to vitamin D, like sorry, or to sun, which makes vitamin D in their body too, you will say. But again, that is very minimal source, okay. So that's the reason vitamin D is, again, you have to rely a lot on supplements, okay. So for that, so the common mistakes that people make, with vitamin D is, the one of the most common mistake people do, as I told you, that vitamin D needs certain cofactors, which are like calcium, which are K2 and magnesium. So vitamin K2, doesn't let the calcium deposit in your arteries, but actually the calcium goes right to your bones. Magnesium increases the absorption of vitamin D2 as well as conversion of D2 to D3. So that's the reason, and most people are low in magnesium these days or suboptimal in magnesium. That's the reason, again, a very important reason that vitamin D is suboptimal in our body. Okay. So that's a common mistake, that people are not taking vitamin K2 with vitamin D, as well as they are not taking magnesium, or they're low in magnesium, which is the reason that their vitamin D levels keep on falling low again and again. Okay. Now, the best thing is that, vitamin D is such a cheap test which is available world over. I always tell people, get your levels checked, right? So people get the levels checked. Now, the ranges, that is also very important to know. If you will look at the vitamin D range, most of the labs, the range is from 30 to 100. And most people are like 32, 33, 34. That is on the low normal range, guys. That is very low. So if the range is between 30 to 100, why would you not like to be in the middle of the range, right? So whenever there is such a wide range, we always want to be somewhere in the middle of the range, because that's where we are getting optimal vitamin D. So make sure your vitamin D levels are between 40 to 60. That is the optimal vitamin D levels, okay? Not in 30s for sure. And the other mistake people do is that, oh, my doctor told me that, take the vitamin D for 3 weeks or 4 weeks, then you leave it, then you're fine. It will always drop down low. Okay. Because what are you doing that is going to raise your vitamin D levels, right? Nothing. Literally, we are not doing anything. So we need some form of vitamin D on the long term basis, so that the levels keep on doing good. Okay. In terms of dosages, dosages vary depending on where your levels are. For majority of my patients, 5,000 international units works really good for them to keeping their vitamin D levels in good levels. Okay. So that's what I recommend. And then combining vitamin D with K2 again works really great. So that's what I recommend. Instead of taking just plain vitamin D, take vitamin D with K2. Okay. As you guys already know that, we have created a specific vitamin D supplement, which has the right dosage, 5,000 with K2 into it. So in the end, you will also see the link to buy that vitamin D if you want to. Okay. But vitamin D, almost everybody needs to take that supplement, or at least get your levels checked to make sure you're not low. Okay. And low doesn't mean less than 30. Low means that anything less than 40 is low. Then comes vitamin C. Okay, another very important vitamin C, right? Now everybody knows about vitamin C, but have you ever gotten a blood test to check for vitamin C? Okay, not really, right? Because majority of the regular blood tests do not check for vitamin C, and this is where we never know that our vitamin C is low or not. So that's very important. And what I've seen when I do advanced testing with my patients, almost 70 to 80% of those have low levels of vitamin C and they have no idea about it. So that's the problem with, like vitamin C. Unless you get advanced testing done, you will not know. Now, why vitamin C is important? Vitamin C is the most potent antioxidant molecule in our body. What is antioxidant means? They fight off inflammation. Okay, so that's what it does. Vitamin C fights off inflammation by acting as an antioxidant. It reduces oxidative stress in your body, neutralizes free radicals, which are basically again chemicals of inflammation in our body. It helps in supporting collagen formation. That's where vitamin C also has anti-aging properties, because it um, improves your skin health and removes those wrinkle marks. Okay, and then we all know that vitamin C is so important is for immunity, right? That's the reason most people are taking vitamin C during the winter months, so that they can keep their immunity in good shape. Now, why are we deficient in vitamin C? Okay. So, first of all, the reason is that we are eating less and less of food which has vitamin C. Okay. Like lemons, limes, oranges, and things. A lot of people are drinking a lot of orange juice, but what they don't know is that orange juice has very less amount of vitamin C. They claim it is very high, but in reality, it is very less, because again, it is processed food. Orange juice, is a processed food. You heard it today. Okay, the reason being, if you eat the whole orange, then your vitamin C levels are still okay. But if you're drinking those juices, that never gives you vitamin C. Okay, so our diet is low in vitamin C. The second thing is that your bodies need more vitamin C today as compared to 100 years ago. The reason being, like we are chronically stressed these days. Okay, and whenever our body is stressed, it requires more vitamin C so that it can handle that stress. Okay, now imagine, if you had a bad day at work, or you are having tough day at relationship, there are so many duties you are juggling every day at home, between taking care of your husband, your children, keeping everything straight, following everybody on social media, listening to Dr. Gupta's videos, right? And then following whatever he wants you to do. All of this is stressful, guys. I totally understand that, right? So that we are all stressed out, and whenever a body is stressed out, whether it's physically, mentally, emotionally, spiritually, that takes vitamin C to handle that stress. So that's the reason our body stores of vitamin C gets depleted very quickly. Plus, like people who are smokers, and then as well as air pollution or all the toxins that we get exposed to, demand more vitamin C from our body. So that's the reason people are low in vitamin C, and then they never kind of know that their vitamin C is low, and that is a very important reason for inflammation levels being high. Okay, what are the food sources? I think most people know about it. These are citrus fruits, lemon, lime, oranges. But interestingly, bell peppers are also good sources of vitamin C. Okay, kiwi is all one of the highest source of vitamin C that most people are not even aware of. Okay, and amla, which is called Indian gooseberry. Guys, this is the highest natural food source of bioavailable food source of vitamin C is amla, called Indian gooseberry. Okay, so yes, it is not available everywhere in Indian continent. A lot of people use it, but the good part about vitamin C in amla is that it is bioavailable, that it is absorbed easily by your body. Okay, but it has a definitely a tart taste to it, so not easy. So yes, very difficult to eat it, but that's where the supplementation is useful. Some people will have amla powder as supplementation for vitamin C. Okay, okay. Now, common mistakes of vitamin C. Okay, which is basically a lot of people are taking synthetic vitamin C, which is ascorbic acid. Okay, the best form of vitamin C which is absorbed is either you take ascorbate as a form, or you take liposomal vitamin C. because those are the only two forms which actually reaches inside your cells, and that's where you need that vitamin C. Okay, so that typical vitamin C that you are buying through your pharmacy shelves and things is basically literally useless, because that is a lab made ascorbic acid, which is synthetic acid, which is doesn't reach inside your cells. So if you want real vitamin C, what you need is ascorbate form or liposomal vitamin C, then only it will work for your body. Okay, what is the typical dosage? 1000 to 2000 milligrams daily basis is what you need a vitamin C. Okay, so yes, like you can do that. The good part is that you cannot get toxic on vitamin C. The reason being, it is a water soluble vitamin, so even if you take a little bit higher dosage, your body will pee it out. Okay, but whenever people take high doses, and if it is inferior quality vitamin C, then it will give you stomach upset. So you will feel a little bit of acid reflux, or you will have some loose bowel movements. That is telling you that the vitamin C was not the best quality, or maybe you need to take a lower dosage. Okay, but vitamin C, that one hidden vitamin that most of the blood tests do not check, most of us are low into. So we need to increase it, because that causes the deficiency of that definitely causes inflammation in our body. Vitamin B12, right? Everybody knows about it. Like vitamin D, vitamin B12 is so important, right? Now, vitamin B12 is another that vitamin which plays different roles in our body. Everybody knows it plays a role into making hemoglobin. So, deficiency of B12 can also lead to anemia. But what people don't know is that vitamin B12 is very important for DNA synthesis, as well as to keep your mitochondria in good shape, as well as to produce and convert thyroid hormones. Okay, and that's the reason when your body is low in vitamin B12, that causes vascular inflammation. Okay, and that typically, obviously, a lot of people will have it. Now, why people are deficient in vitamin B12? First of all, vegan and vegetarian diets are low in B12. Even though there might be some B12 in vegan and vegetarian diet, but again, it is not in the absorbable form. So it is very common for vegan or vegetarian levels of B12 to be low. Gut, malabsorption is there. Again, our guts are not functioning. Most people will have either low stomach acid, or they have something called SIBO, or they have too much of the bad bacteria in their gut, which again interferes with B12 absorption. And then plus, people can have autoimmune gastritis. Like a lot of people might have autoimmune diseases like Hashimoto's disease, and their chances of having autoimmune gastritis also increases, which again lowers your B12 levels. So that's the reason your B12 levels are low. What are the food sources? Unfortunately, majority of them are animal sources like liver, eggs, fish, meat, dairy. These are the sources of B12. Again, very, very few vegetarian sources. So that's the bad news about vegan or vegetarian people, that they have to rely on supplementation. Okay, what are the common mistakes? First common mistake is taking the wrong B12 supplement. So B12 supplement which is available over the counter are typically cyanocobalamin or mecobalamin. Okay, that is not doing anything for your body. You only need methylcobalamin, what we call as methylated B vitamins only. That's the only time they actually work for your body. Okay, and unfortunately, majority of the pharmaceutical shelves will not have methylcobalamin or methylated B vitamins. So very important to take methylated B vitamins only. And if you can find a sublingual form that is absorbed directly from your mouth itself, that is even better. But I will say, if you're taking methylated B vitamins, even oral, like liquid form or capsule form is also fine. The typical dosage is 1000 and 2000 milligrams, okay, of not, oh, sorry, let me take that back, micrograms, okay, mcgs. 1000 mcg is a typical dosage, not milligrams, that you can take of B12, but only methylated B12, okay. Then comes magnesium, the master anti-inflammatory mineral. Magnesium is a cofactor in more than 300 enzymatic processes. It is responsible for making energy because it supports your mitochondria. It relaxes your muscle, keeps your heart healthy by taking participation on relaxation of heart muscles. Okay. When there is deficiency of magnesium, NF kappa B activation happens, which is your inflammatory switch gene. And when that is turned on, chronic inflammation happens. So that's the reason magnesium is that master anti-inflammatory mineral. Most of us are low in magnesium. Why? The reason being the soil, which has magnesium, which our food gets the magnesium from, is low in it. Okay, there was a research study done which compared the magnesium levels of food from 1980s to 2010, and it showed that the current crops and current food has significant lower amount of magnesium as compared to 1980s. So even though you might be eating the healthiest food, this particular mineral, because of modern agriculture, they do not add certain minerals back to the soil, it is low. Okay, so that's the reason it is there. Certain medications like coffee is a medication for me, alcohol, certain medications like PPIs, anti-acid medications, antacids depletes magnesium further. Okay, so that's the reason we are low in magnesium. Again, there are certain vitamins like vitamin D, almost everybody needs. Similarly, magnesium, almost everybody needs it. Okay, even I take magnesium on the regular basis because there is no perfect test. Even though you do a magnesium blood test, but that doesn't tell us the RBC magnesium. It tells us magnesium in your serum, but we need RBC magnesium only. Okay, so that's the reason magnesium everybody should take. Okay, food sources, this is where we do have food sources across both vegetarian as well as animal products. So pumpkin seeds, almonds, spinach, dark chocolate, avocados, they're all great sources of magnesium. So again, you can get through that. But again, the problem is that it is not very well absorbed, and as I said, our food itself is low in magnesium, so that's where the problem is there. Common mistakes is that basically we are taking wrong form of magnesium supplement. Okay, so there is magnesium oxide, then there is magnesium carbonate, which are the most common forms. They are completely useless, they are very irritating to the gut, so stay away from them. The best form of magnesium is magnesium glycinate or magnesium bisglycinate. Okay, this is the magnesium which is the most very well absorbed. Then after that comes we can do magnesium citrate only if you are feeling having constipation in your gut. Then there is magnesium threonate, which is really good for your brain. So if you have brain fog, then magnesium threonate is also fine. But for overall basis, I will say magnesium glycinate wins the bet over here. That's what I will recommend for majority of my patients. You take it at bedtime, improves your sleeping, improves your mood, rebalances hormones, reduces inflammation. Typical dosage between 300 to 500 milligrams on the daily basis at bedtime. Again, most people can take even higher doses of magnesium because typically there is no toxicity of it. Okay, and as you guys know, we have created a very great magnesium supplement, magnesium complete and magnesium glycinate, which is great, gives you the right form of magnesium. Okay, so you have that option of buying it. Okay, magnesium, again, very important mineral, everybody should take it. Iron, this is where when somebody was asking me that I have low hemoglobin levels. Low hemoglobin levels, one of the major reasons is iron deficiency. The other reason can be B12 deficiency, but iron deficiency is one of the major ones, specifically in females. Iron, people think it is only for anemia, right? But what iron also supports is actually your mitochondrial health. Okay, how you make energy. Whenever our body is low in iron, our body cannot produce different kinds of hormone, including thyroid hormone. And whenever there is hormonal dysfunctions going on, what happens? Inflammation increases. Okay, so that's the reason iron being very important mineral. But again, we should not take blindly iron supplements because excess iron is also bad and low iron is also bad. So this is where I always recommend getting your iron levels checked. And if you are in the low normal range or even low range, then you should take iron. But let's say if you are excess in iron, then you should stay away from it. Now in blood testing, I don't know if you have seen my recent video. I have made a great video actually to help you understand low iron and low ferritin. So if you have not looked at that video, I will recommend you to go and check it out because it tells you about low ferritin. So low ferritin actually is a better blood test to check for your iron in your body rather than just plain iron. So a lot of people are just getting their iron levels checked, which is not enough. Get your ferritin levels checked. And if your ferritin levels are less than 40, that is telling you that your iron is suboptimal. This is where you need to take, iron supplementation. What are the food sources? Again, major food sources of iron are actually animal products. One of those highest is red meat, liver is one of the highest sources of iron. And then, you can have some vegetarian sources like spinach, lentils, other things also have some iron. Common mistakes with iron supplementation. Again, most people, are taking the wrong form of iron, and that's the reason they will get constipated. Okay, so ferrous carbonate, sulfate are bad sources. Ferrous gluconate is the best iron supplement that you can get, that is readily absorbable and doesn't give you constipation. Okay, so get ferrous gluconate as a supplement for iron. Now, when you take iron supplements with your tea or coffee or other calcium supplements, then the iron doesn't get absorbed. Okay, so that's the reason you need to stay away from it and make sure you are not doing that and taking iron supplementation with vitamin C, actually, because vitamin C containing foods like lemon, lime, or oranges or something will increase the iron absorption. So do that. Okay, so check your iron levels, check your ferritin levels, and then if you're low, then only take iron supplementation. Then comes the zinc. Okay, everybody knows about zinc, I hope by now, because in each and every of my video I talk about zinc, so important for thyroid gland. But we know that zinc is so important for also maintaining our immunity, right? This is also the reason why zinc is important in thyroid gland, because it is maintaining the immunity in the thyroid gland. It regulates this enzyme, the superoxide dismutase. Okay, so that's the reason when we are low in zinc, body's immunity goes low and inflammation levels high. And a lot of people are low in zinc. Okay, so for various reasons. So again, one of those important things, and unfortunately regular blood test doesn't check for zinc levels. So that's the reason some people will just have to supplement zinc on their own. What is the food sources? Again, animal sources are the best, because those are the ones which are absorbed the best. So oysters and beef is the highest source of zinc, but pumpkin seeds and chickpeas also have some zinc. So if you're vegan or vegetarian, you can rely on them. Okay, now, what are the common mistakes is that, again, like you have to take a proper dosage of zinc, and overdosing is never a good choice, because if you're taking too much of zinc, that can actually lower copper levels. So most people are unaware of that, and certain supplements have very high doses of zinc. So I recommend only between 30 to 40 milligrams of zinc on the daily basis, because higher than that, then you are risking copper deficiency, which creates other problems. Okay, so zinc between 30 to 40 milligrams on the regular basis is typically good for most of the people. Selenium, right? Selenium is another supplement. It is needed for glutathione peroxidase. It is needed for thyroid gland to produce thyroid hormone. And again, deficiency of selenium has shown that it increases the inflammation levels in the person's body, and then also increases the thyroid antibodies, autoimmune diseases. Okay, again, most of the lab tests cannot check for selenium, so that's the reason most people don't know about it. And again, like magnesium, selenium is another mineral which is low in our food currently, because our soil is low in selenium. Because again, when in modern agriculture, nobody replenishes selenium in the soil. That's the reason the selenium is again low. Okay, so that's the reason, like people need selenium as a supplementation. What are the food sources? Unfortunately, not many food sources are there. One of the food sources that we know about is Brazil nuts. Okay, that is the highest source of selenium. But what I noticed was that the Brazil nuts, depending on the quality, the grade, as well as the country of origin of Brazil nut, actually determines the amount of selenium. So it can be anywhere from 20 micrograms to 60 micrograms of selenium in one Brazil nut. Okay, so that's very difficult to kind of pinpoint it. But I will say most people, I will recommend not going beyond 1 to 2 Brazil nut per day, just to be on a safer side. Because again, if you take too much of selenium, okay, that can also harm your body. So that's where there are certain vitamins and minerals which are completely safe, but selenium is not one of those if you're taking too much of it. So again, only 1 to 2 Brazil nuts. Otherwise, if you're taking supplementation, that is definitely a safer way, because you know how much you are taking. So researchers show between 100 to 200 micrograms of selenium on the daily basis is safe, and that has the best health potential for you. And again, selenium supplementation comes in different forms. Selenomethionin is the best form of selenium. So I will recommend you to find a supplement which has selenomethionin. And as you guys know, we have made this thyroid balance supplement, which has the zinc and the selenium and everything in the right form and the right dosage. So again, you can check out that supplement in case you have thyroid issues, or in case you just want to keep your thyroid in good shape. You can take it as a preventive measure also. Okay. So selenium, unfortunately, not many blood tests can check for selenium. But if you want to take it, sometimes you can start with Brazil nuts. If not, you can always take a supplementation. Do not go beyond 100 to 200 micrograms of selenium, and only selenomethionin form. Omega 3 fatty acids, another favorite supplement of mine. Everybody should be taking omega 3s, okay? Because this is one of the potent, ways to lowering inflammation in the body, okay? Specifically EPA and DHA. So again, I want you to understand this very important thing is that omega 3 fatty acids basically is a big category of fatty acids, okay? This is not one fatty acid, okay? And the only research study has been done is on EPA and DHA, which are only two kinds of omega 3 fatty acids. Okay. And research shows that these are the only two fatty acids which has the best potential in lowering inflammation and supporting our health. So whenever you are buying a fish oil or a omega 3 supplement, make sure you check the levels of EPA and DHA. Okay. Not just saying that, okay, well, this supplement is omega 3 fatty acids of 1000 milligrams. That is useless. You need to know exactly how much EPA and DHA it has. Okay. So again, deficiency of omega-3 fatty acids has lead to inflammation. There is no doubt about it. Now, the important thing to know about is between omega-6 and omega-3s. Okay, so omega-6s are basically present in seed oils like soybean oil, like canola oil, vegetable oil. And then what research is showing is that it is the balance between the omega-6 and omega-3 is basically which is more important in controlling inflammation. So what is happening in this modern day lifestyle is that we are consuming too much of these seed oils. So we are getting too much of omega 6 but very less amount of omega 3. So that creates an imbalance between the ratio of omega 6 and omega 3, and that's the reason we're getting too much inflammation. So what you need to do is that give up those seed oils, replace them with other sources of fatty acids or oils like coconut oil, like your olive oil, your Indian ghee or avocado oil, which has less amount of omega 6, and then include more omega 3s in your diet. Obviously, everybody knows the highest source of omega 3s are the fishes, which is the salmon, the sardines are the highest ones. If you're vegan or vegetarian, you can include flaxseed oil or walnuts, okay, and algae oil. That is going to give you the omega 3s in the natural way. The common mistakes, the most common mistake people are doing is buying the wrong form of omega 3 supplement. Okay. So the reason being, omega 3s come from fish oil, comes from fish. Fish can be high in mercury. So if you're buying a supplement which is not checking itself for mercury, then you are actually making yourself toxic with mercury. The second thing is that if the supplement is not telling you the milligrams of EPA and DHA, then it is a useless supplement, because you need a minimum of 1000 milligrams of EPA and DHA to have an anti-inflammatory benefit. So omega 3 supplement will say it has 1000 milligrams of omega 3s, but EPA and DHA will be only 200 or 300. That doesn't work. Okay. So that's the reason a very good omega 3 is one of the supplements that I always tell people is get the best source of it, because otherwise it is completely useless, actually can harm your body. So this is where we have done a lot of research and came up with the best source of this omega 3 supplement, which has the highest amount of EPA and DHA in the market, and also purest quality, and with no mercury. Okay, so you can check out the link to if you want to buy it. But omega 3 dosage between 1000 and 2000 milligrams of EPA and DHA. Okay, so these are all the vitamins and minerals. Okay, now the important thing is that as I shared with you before, our body is not just one particular organ. It is basically working together. So we need to use these vitamins and minerals synergistic approach together so that they can help support each other. So that means when you're taking vitamin D, make sure you're also taking it with K2 and magnesium, not like together in vitamin D and K2 together, but magnesium can happen later in the day so that you can increase the absorption. Vitamin C is also be important to be taken with iron. So if you're taking iron supplement, make sure you're taking a vitamin C supplement so it increases the absorption. If you're taking zinc and selenium, if you're taking selenium or zinc, make sure you're taking them together. So zinc plus selenium is important, then only they work. Okay. And then adding vitamin C is basically cherry on the top. When you are adding omega 3s, make sure your vitamin B levels are good. Okay, so because both are needed for mitochondrial functioning. Okay, so that's very important. Now, hopefully you are able to check some of these vitamins and minerals, but not all of them. This is where functional medicine advanced testing is useful, because it checks for all of these vitamins and minerals so that you know exactly how much it is done. So look for a functional medicine provider who has access to these advanced testing so that they can check all of these vitamins and minerals for you. Okay, so that will definitely be the case. Okay, so this is where, like, again, like, this is the plugin from my side. Like, I just want you to be aware of it, that we have a good supplement line, because most people keep on emailing us that, where do I buy the supplements, and they're unaware that we do have this supplement line which has the great quality. I have researched them and worked with this supplement line for a long time. So vitamin D, good quality omegas, this Inflammapro, which has all the things to reduce inflammation in your body. So definitely a great place to start if you have autoimmune diseases, if you have Hashimoto's disease, if you have too much inflammation in your body, or you just want to safeguard your body, then I think this anti-inflammatory bundle will be really good for you. This is where you can buy it. Functional Wellbeing is our shop for international clients. For, we have another shop for Indian clients, which are located in India, which is Dr. Gupta Functional Center. So we'll post that link into the chat section. That is only if you want to buy that supplement from India. If you want to work with me to get consultations, getting more advanced testing done to check the root cause of your inflammation and then also get rid of the inflammation. So we do provide consultations worldwide. So you can work with me that way. Okay. You can always email me to get more information about how to work with me. Okay, guys, so that's what we have for the presentation part of it. I think that was a little bit long presentation, but there was so much I wanted to cover with you guys, so that way I can give you the complete information. I will take some questions, so please feel free to post questions into the chat section so I can start answering those for you. Okay. Okay, so let's see. Some people have already posted the questions, so see what questions people already have posted so I can take those. Hmm. So somebody this question, my blood test showed I had low and extremely deficient in copper. Okay, so yes, like if you're taking a zinc supplement, that can lower your copper levels. Otherwise, yes, another problem that we can be in low in copper. How can you know that whether you're absorbing this nutrient or not? Get a gut analysis done. Okay, so there are special stool tests now which can tell you whether you have leaky gut issues, whether you are malabsorption issues, where not absorbing things from your gut. So if you have access to that test, that will be great. Otherwise, look for a functional doctor who can order the test, so you will know exactly whether the problem is that you're not absorbing that nutrient or not. Okay. So Mary has this question, like, Hashimoto's condition, milk is not allowed. So is there any other food source of vitamin D? Unfortunately, if you're vegan or vegetarian, there is none. Some mushrooms actually have it. Okay. So I think somebody is answering this question later on. Yes. So just putting out mushroom for half an hour outside, like, in the sun, does that increase vitamin D? I don't know. There is no research study done. And then, so it is just kind of, a layman way of doing it. But certain mushroom varieties which has been exposed to sun when they are being grown, then definitely they can produce vitamin D. Okay. Now, how to find those mushrooms? I have no idea. Maybe you can look for companies, which claim to do it that way. But that is one food that has high vitamin D. Otherwise, you have to rely on supplementation. Or maybe what you can do is that, you can expose, your skin to vitamin D for, like at least 20, 30 minutes or 40 minutes a day, and see if that increases your vitamin D levels. Otherwise, like, I don't have good suggestions of increasing vitamin D levels only through food, because unfortunately there is none. If we drink homemade orange juice, will the juice have enough vitamin C? Again, it's a whole process, okay, of squeezing out juice from oranges, which sometimes disrupts the chemical molecule of vitamin C because it is a fragile molecule. And that's the reason I don't like it. Why not eat whole oranges? That is definitely much more healthier. It gives you the right fiber, will not give you the sugar spike, plus will also give you vitamin C. And we know that vitamin C is good for your body. So I will always recommend whole fruits and never recommend juices, because they are just basically plain sugar, never good for your body. So my recommendation still is eating that one orange is better than like than drinking the whole glass of orange juice, which will be three or four oranges. But I will still recommend eating that one orange. So absolutely. Let's see. Somebody has this question: do you recommend taking a multivitamin on top of these specific supplements? Actually, I don't like multivitamins, because most of these multivitamins will have certain vitamins in higher amount than the others. And a lot of these vitamins can be fat soluble vitamin, which you can overdose on. So I don't like multivitamins. That's the reason, because I have not found a multivitamin which is perfect, and oftentimes they can do harm than doing good. So that's the reason I will say that the vitamins which I've shared with you, that's the reason I've shared these specific ones, because, and I told the caveats, between all of them, so you are aware of it. So my recommendation will be stick with these vitamins and not go for multivitamins unless you have a specific reason. I just hate those multivitamins, to be very frank. I never recommend it to my patients. Okay. Which is the best magnesium, which we already discussed about it. Magnesium glycinate is the best one. So you, hopefully you got that through this through the presentation that way. Will biotin help with female hair loss? Can it be taken with levothyroxine, and what dose, please? So first of all, biotin, yes, it is really good for the hair loss problem, but biotin interferes with thyroid blood test. So first of all, never take it with levothyroxine. Take it away from levothyroxine. So if you're taking your levothyroxine in the morning, which is what I recommend, empty stomach without anything, you take your biotin not earlier than afternoon. Okay, that's first thing. Second thing, most people do not know is that when they're doing their blood test, they need to stop biotin supplement 7 days before the blood test, because it is going to interfere with your blood test. Okay, again, not most people are not aware of it. They will check their blood test, and that is, always haywire. They have no idea about it, and then suddenly when they start seeing me and I say, well, did you do the blood test? Were you taking a biotin supplement? Oh yes, my doctor said that biotin is good for hair loss, which is great, but he forgot to mention that you have to stop it for 1 week before you do the thyroid blood test, because it is going to interfere with your results. Okay, the next question: how do you feel about use of CBD oil for inflammation? Amazing, great, no problem with it. It is good, works for a lot of my patients. CBD oil has several health benefits. Lowering inflammation is definitely one of those. Okay, specifically adrenal inflammation. So if you're feeling anxious, if you're feeling stressed out, your adrenals are taxed out, then CBD oil works great. If you do have body pain issues like inflammation in your joints or your muscles, again, CBD oil is good. But again, getting good quality CBD oil is important. So look for one and using it. So, but yes, CBD oil is good. Um, what is the best supplement to take for chronic stress? There is not one supplement that like helps with chronic stress, but adrenal supplements are the best one over here. Okay, adrenal supplements includes adaptogens, which is a combination of sometimes ashwagandha or rhodiola or sometimes it is valerian roots, or it is sometimes ginseng. So those adaptogenic herbs are the best to support your adrenal glands, and those are your stress glands. Okay, so we have an adrenal supplement which is a combination of a lot of these vitamins, minerals, and herbs. So you can check it out on our website. So that will be the best supplement that is good for adrenal stress is adaptogens. Ashwagandha, rhodiola, ginseng, B vitamins, vitamin C, all of those are really good in that way. Okay, my test showed a low border iron and high ferritin. So now the ferritin is an interesting molecule. High ferritin levels and low ferritin both are problematic. High ferritin can also be an indirect sign of inflammation in your body, specifically because of infections. So if you have a bacterial infection or a viral infection going through, your ferritin levels can also be high. Okay, so again, look for that source. If your ferritin is high, because your iron is low, is that chronic infection which is leading to your ferritin levels being high. Okay, so that's the case. Okay, somebody is messaging again and again about saying that make a video on permanently curing ankylosing spondylitis. Thank you so much. I got the point. I will try to make a video on this. As soon as I have more information and I am comfortable sharing the information which is research backed. Okay, my goal is to only share information once I am comfortable and I am sure what I'm sharing with you is research backed and it's just not in the air. Okay, so when I'm comfortable, I got your point. Thank you so much for posting it again and again over here. I totally understand you're suffering through ankylosing spondylitis. We'll look and research and we'll try to make a video. Thank you so much. Okay, alrighty, let's see. Other people have other questions. Terry says that, I like reishi mushroom for stress. Absolutely. Like there is no question. Reishi mushrooms are also great for stress and they work on your immune system, lowering inflammation, and definitely are good for immunity too. So, absolutely. Um, let's see. Best foods for inflammatory bowel disease. Obviously there is not one food, there is a combination. So again, please check out my YouTube channel. I have made a lot of videos on anti-inflammatory diets and anti-inflammatory foods and things. So hopefully you will get some ideas about it, of following that particular diet, which is a food which is good for you, also knowing the food which is bad for you, so you can lower the inflammation, specifically for IBD disease and IBS also. Can you please share a presentation PDF? Yes, I realize that is a lot of good information over here. So we will post the link tomorrow into the community section where you can download this whole presentation. So check out, keep checking our community section. We post great content over there. And also time and again, we keep on posting some free PDFs and free presentations which you can download. So yes, we are going to post this presentation tomorrow in the community section where you can download from. Okay, great guys. I think we're coming to the end because it's almost been an hour and you have been very patiently with me. And I'm so grateful for you all spending the time with us. So I'm really, really happy about that. And I hope these videos are useful for you and these live sessions are useful. The goal is to keep trying to do them again and again and as many as possible, because I want to connect with you all. Because like I want to help you out to achieve the best health for yourself. So we'll come back again for live sessions, hopefully sometime, in another month or so. And then keep communicating with me what kind of videos you want, what kind of topics are bothering you, as well as sharing our content with others, so that others can also benefit from it. And then keep checking our community section. Okay, this is where I post a lot, like about what is going on, what we are going to do. And yes, we are coming with a summit, a thyroid summit in January. So we are going to post more about it soon in December, and I have over 30 people I have interviewed. Lot of great content you are going to love. So again, keep looking at the community section. When that the link and everything will be out, we'll share with that. It is free and you can attend it online wherever you are. So that's it. I think somebody has this question: how long can we take vitamin D? So that's what I want to share with you. Is that as soon as you're going to stop taking vitamin D, your levels are going to fall low again. Okay. Yes, you might take a break, for maybe a couple of weeks or so, but you have to take consistently vitamin D so that your levels are good. Otherwise, you will always be in good range of vitamin D. You don't take it, you fall back again, come back again, you fall back again, and your body never likes it. And that's the reason people do not see benefit from vitamin D, because they stop taking it after just a few weeks. So keep checking your blood work. If you're going very high, then that's the time you stop it. Otherwise, you keep taking vitamin D, and then so you will be there. Okay. Where do I get the link for the community section? Well, it's this YouTube community. Okay. So if you will go to our channel, you will see a community section over there. That's what basically it. We do not have a private community of like on a Facebook or any other group, but it's basically on YouTube itself, where there is a section for community, where you will be doing that. Okay, guys, it was really, really nice connecting with you. Thank you so much for showing the love, the care that you are giving to me as well as our channel. Sincere thanks to you. And I hope that all the videos and all the information I'm sharing with you is useful and is making a change in you. So thank you again. Yes, we will come back again soon, and yes, we will be sharing this PDF. So check out, as I said, the like the posting section tomorrow, so that way you will get the link to download it and then use it for your own benefit. All right. Thank you so much. Take care. Have a nice day. Bye bye.